Hi, this is Elliot Lander. I'm Medical Director of the California Stem Cell Treatment Center and the Cell Surgical Network. I'm here to talk to you today about our organization, our history, our philosophy, our capabilities, and our goals for our research network. In 2010, my partner, Dr. Mark Berman, and I formed the California Stem Cell Treatment Center. This is our location in Rancho Mirage, which is 2 hours east of Los Angeles. We also have another In 2010, Mark Berman, who's a cosmetic surgeon and an international expert on fat transfer, brought the technology back from Asia to procure stromovascular fraction from fat. Stromovascular fraction is rich in adult mesenchymal stem cells and growth factors. We were looking at anecdotal data and international data indicating safety and efficacy. We looked at VetStem, which had treated 10,000 large animals with stromovascular fraction with excellent efficacy and safety. And it was clear that in order to study SVF in the United States, we'd have to do it as an investigational study, since data was scarce regarding its use in the continental U.S. We had access to customized equipment that can derive SVF. We formed multi-specialty teams since we felt it's very important that physicians should practice within their scope of expertise, and many of the conditions we were looking at were, for example, orthopedic or neurologic. We obtained IRB protocols, and also we forged ahead to identify the optimal conditions and deployment techniques. Regenerative medicine is the use of stem cells and growth factors to repair tissue. Sometimes it's done directly by engraftment and transdifferentiation of regenerative cells, and sometimes indirectly through a paracrine type effect, where cytokines or growth factors are used to stimulate tissues to repair themselves. Stem cells can form other stem cells and, of course, other tissues. We all know about embryonic and adult mesenchymal cells. The embryonic cells have less and less efficacy for clinical use since they can form teratomas, and there's some ethical issues associated with deriving them. Reaction. Adult mesenchymal stem cells are found all over the body, not just in fat or bone marrow. They're the same cells we also find in umbilical tissue. Adult mesenchymal cells can form many types of tissue, even conditions. Stromovascular fraction containing adult mesenchymal cells works based on two main properties, homing and activation. These homing and activation properties, which I'll discuss momentarily, permit SVF to be used as a regenerative or trophic therapy, an anti-inflammatory, or an immunomodulatory, not immunosuppressive therapy. There's also some anti-tumoral and antibiotic effects which are just now being discovered. Homing properties based on the cell's ability to respond to damaged tissue and its cell signaling molecules that send out the homing message that brings the cells in. Once the cells are homed, they are then able to be activated by the similar growth factors or cell signaling molecules. Here's an example of the homing ability of cells. This SVF is radio-labeled with technetium. You can see it going up the left arm on this gamma camera image. It's going to liver and spleen and lungs, and of course concentrates in the bladder, but you can also see that it's in here the penis for Peyronie's disease. This patient also had Dupuytren's contracture, and also here the cerebellum. The patient had cerebellar disease. All of these effects are mediated by growth factors or cytokines. These are approximately 120 to 200 amino acid polypeptides. There are 2,700 known, and stromovascular fraction contains probably hundreds of uncharacterized. In the US, we don't use bone marrow-derived cells since the numbers of cells are so low that we would have to grow them in a laboratory to get therapeutic threshold number of cells. But other reasons not to use bone marrow cells are the diminution in quantity and quality with age and chronic illness. Bone marrow goes down with age. There are two types of stem cells. Stromovascular fraction has a number of different ingredients. It not only has preadipocytes but also perivascular mesenchymal cells. We obtain stromovascular fraction through a mini liposuction. We use a closed system to separate it so the fat and cells are not exposed to air during any time in the processing. We use a GMP grade collagenase, which is very important to prevent transmission of disease. We filter our cells and photomicrograph them for. This is what the fat looks like prior to processing, compression or condensation, and then digestion. Collagenase is considered minimal manipulation by the Korean FDA. An FDA tissue reference group letter indicated that more information is needed before they can approve it. Many of our colleagues have asked if collagenase is legal, and we explained to them that the tissue reference letter to the FDA asked if we could use, if one could use collagenase to isolate stem cells without specifying whether the collagenase was GMP or not, and also without specifying any other information about the process of isolating stem cells. We don't claim to isolate stem cells. All we're doing is procuring SVF. The collagenase breaks down the collagen but doesn't affect the cells themselves. Roche did these studies with us showing that all the collagenase gets washed out after. We use the time machine, which is a modification of the LipoKit. It's 1/3 to 1/5 the price of the other two closed systems available, Tissue Genesis and Cytori. There is no hood or laboratory aspect to our procedure. It takes only 90 minutes to procure our SVF, and only a very small amount of fat is required. We have a proprietary anesthetic approach that is not tumescent, since tumescent anesthesia will result in cell. This is a device we use to count human tissues. Doesn't mean you have to be a surgeon to use it, just a clinician. But it's not a laboratory procedure. It's a type of lipotransfer procedure. We have a responsibility that we don't harm our patients, that we give proper informed consent, that we operate and work within our scope of expertise. We must maintain surgical sterility, not laboratory GMP sterility, and we have to be rigorous regarding our outcomes and following up our safety and efficacy using a proper database. We have over 700 cases in our database showing no major complications and only a few minor complications, mostly unrelated to the cell surgery. This is an example of some of the orthopedics protocols. Here's a patient whose medial compartment of their left knee received SVF injection 4 months later in this space with regeneration of cartilage. This is our hip data, visual analog pain scores over 2 years on approximately 40 hip patients, and it shows improvement every 3 months, indicating that this is not a placebo effect. An example of some of our complex deployment techniques includes adding shockwave therapy to our erectile dysfunction treatments. That creates a controlled microtrauma that activates certain cytokines that home and activate the regenerative cells. We had no response to treatment of ED prior to using the shock. Featured here, here's the handheld radial head. With combination of shockwave and SVF, 9 out of 14 patients showed significant improvement of ED at 3. Here's the overall sexual satisfaction score at 3 months. Baseline is in blue, 3-month is in green. In 2012, Dr. Berman and I decided to help other doctors learn to do what we're doing, and we formed the network so that we can spread our knowledge in a standardized and ethical fashion. This allows us to do multi-center research using the same equipment and the same protocols and the same database in all of our centers. We now have 41 centers in the US and a number overseas, and we all receive the same training and we do the exact same procedures. And we're finding that the results are recapitulated in center after center. So much of our medical literature is filled with findings from single centers that could not be reproduced when done elsewhere. We provide some marketing, administrative, and academic support. Our affiliates in the United States are provided with malpractice coverage. Our database is secure and compliant, and it's very robust, and you can mine data to follow outcomes which you can show to colleagues, patients, regulators, payers, and most importantly ourselves so that we can learn what we're doing right. Our goal in the future is to grow the network. We want regenerative medicine available everywhere in the world. We would like to advance the field of translational research and continue to identify and explore new deployment techniques that are applicable not only to our SVF clinics but also to any type of cell therapy in the future, even including allogeneic cells. Thank you very much. This is our website if you wish to contact us.